So I'm a GP, and I've been in general practice for 31 years now. And I have to say that patient and public involvement slowly crept in, probably at the time of PCGs, primary care groups, maybe some of you might remember. And it was in a very rudimentary form at that point in time, and we kept on getting assessed. Patient and public involvement. We want to do it, but we don't know how, and we're trying. Anyway, that was actually in 1999-2000. And this is a story about really how we have evolved patient involvement in Wandsworth up until now, and how we are hopefully prepared for April the 1st, when our CCG becomes live. And so it has actually been in a developmental form, and it's evolved over the years. And one of the issues that we've had is how to get acceptance of patient involvement in the heart and minds of the NHS. And we've started at the periphery. But if there's anything that I can say about these modern, or these new models of care, is that finally I think that the patient voice is getting into the heart of the thinking. And now that the genie's out of the box, it's going to be very hard to get it back in again. So, in Wandsworth, what we've done, prior to the PCT becoming a CCG, we were charged with developing the whole strategy so that it's fit for purpose for the CCG. And so we went into the transition period about 18 months, 2 years ago, and we were fortunate to have a grant of about 50,000 to help us to start this. And what we did was to create a steering group, and the steering group was chaired. We invited the link chair to become the chair of the steering group. So a team of 2 went up to a team of 3. We invited representation from the borough, and we invited a representation from the commissioning group itself. And so this steering group actually created the format to develop into the CCG. We decided that we wanted a strategy that was based on the patient voice, not on 3 of us sitting in a room creating a strategy. And so we used all the database that we had and all the voices that we had already established over the previous 10 years to come together in a workshop to look to see what they wanted from the strategy. And then 6 months later, we presented it back to them. So ultimately, the final strategy that we have for the CCG is founded in the patient voice, and the workshops, we had 150, 200 people coming to them. So they were really very broad. And so an action plan was developed, and just to take it on into the CCG, we had to have some kind of structure.